She was young, beautiful, healthy, and had only one complaint: a missed period and mild abdominal pain. No bleeding. There was nothing alarming, nothing dramatic. But within a few hours, she was fighting for her life on the operating table of the hospital. Her abdomen was filled with blood. This is the story of a near-miss ectopic pregnancy, a silent killer that almost claimed another life. Ectopic pregnancy is one of the most dangerous emergencies in obstetrics and gynecology. It occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. And unlike a normal pregnancy, this woman cannot survive. But worse still, it can rupture, causing catastrophic internal bleeding. Subscribe to this channel and let me share with you a real-life inspired case of a woman who nearly died from an undiagnosed ectopic pregnancy, and what every woman, her husband, and even every doctor must learn from this. Her name was Ada, a 29-year-old trader, married for 2 years, trying to conceive. She had become very excited when her period was late by just 2 weeks. She suspected she might finally be pregnant. But about 10:30 in the morning, while selling garri to a customer, here came a dull nagging pain in her lower abdomen. Not severe, not alarming. So she ignored it, like many women would do actually. 3 days later, the pain worsened slightly. Still, no spotting, no bleeding. She decided to visit a small pharmacy store adjacent to her shop. They performed the pregnancy test and it was positive. She screamed in excitement for joy, ready to break the news to her husband when she retires home for the day. But the pain persisted. She was given some painkillers and told it's normal in early pregnancy. And that was the very first missed opportunity at prompt diagnosis. Later that evening, everything changed. She suddenly felt dizzy, sweaty, weak and exhausted. Then she collapsed. Her husband rushed her to a nearby hospital. By the time she arrived, she was pale, barely conscious, and gasping. Her blood pressure was dangerously low. Her pulse was racing. The doctor on call immediately suspected something serious. Pregnant woman with abdominal pain in hypovolemic shock. One diagnosis stood out, until proven otherwise: a ruptured ectopic pregnancy. So there was no time to waste. Unknown to Ada, the pregnancy was growing inside a fallopian tube. As it expanded, the tube stretched beyond its limits. Eventually, it ruptured. Blood began to pour into her abdominal cavity, liters of it. But it was a silent event. No external bleeding, no appreciable warning, just internal hemorrhage. She was rushed in for an urgent ultrasound scan. The findings were devastating. She had an empty uterus, free blood collected in her abdomen, and a tiny suspected mass barely hanging somewhere in her fallopian tube. A confirmed diagnosis of ectopic pregnancy was instantly made. Her PCV was critically low. She needed an emergency surgery immediately. So within minutes, she was wheeled into the operating theater. Intravenous lines were secured, blood transfusion started. The surgical team prepared for a life-saving laparotomy. As the abdomen was opened, blood gushed out. About 2.8 liters was suctioned out. The bleeding was controlled. The source of the hemorrhage was a ruptured right fallopian tube. There was no option but to remove the damaged section of the fallopian tube through a procedure called salpingectomy. Her abdomen was cleaned, and she had 3 units of fresh blood transfused intraoperatively. Slowly, her vital signs stabilized. Thankfully, Ada survived, but just barely. She spent days in the hospital recovering, weak and shaky, but grateful for life. She had come close within minutes of death. This is a true near-miss case. In medicine, a near-miss refers to a patient who nearly died but survived a life-threatening condition. Ectopic pregnancy is one of the leading causes of maternal near-miss and death, especially in low-resource settings like very rural sub-Saharan Africa. And the scary part is this: it often presents very silently. But why is this case so important? The story highlights several critical lessons. Number one, ectopic pregnancy can be silent. Not all cases present with the classic triad of lower abdominal pain, missed period, and genital bleeding. Sometimes, just one or two of the symptoms are present. Number two, a positive pregnancy test does not mean a safe pregnancy. A pregnancy test only tells you that pregnancy hormones exist, not where the pregnancy is located. Number three, early ultrasound scan saves lives. Every early pregnancy with pain should be reviewed by a doctor and evaluated with an ultrasound scan. Number four, delays can be fatal. In Ada's case, for example, the time lapse between the pharmacy visit to her collapse brings to fore a delay that nearly cost her life. Some women are at higher risk. For example, a woman with a previous ectopic pregnancy, ladies with pelvic inflammatory disease, previous tubal surgeries, infertility treatment, and smoking. But here's the truth, it can happen to anyone, even without the risk factors outlined above. If you are pregnant or you think you might be, seek urgent care if you experience low abdominal pain, shoulder tip pain, dizziness or fainting, weakness, sudden collapse, because these are red flags of internal bleeding. Let's be honest, Ada wouldn't have bled internally so much to the point of collapsing or needing multiple units of blood transfusion. This case would have ended differently if an early ultrasound scan was done, proper clinical suspicion was raised, or if she presented earlier to a hospital. This is why awareness is everything. It makes all the difference. Beyond the physical survivor, there is emotional trauma, loss of pregnancy, fear of future fertility and pregnancy, and anxiety. For Ada, survival came with a cost, but also she was fortunate it came with a second chance. Can she still get pregnant? Yes, why not? Many women go on to have successful pregnancies and deliveries after losing one fallopian tube. But they definitely need proper follow-up, early monitoring in future pregnancies, and prompt medical care. To every woman watching this video, do not ignore your body. Do not be involved in self-medication for pain in early pregnancy. And never assume everything is normal just because a pregnancy test is positive. Ada walked into that day expecting nothing more than a confirmation of pregnancy, but she almost didn't make it out alive. Ectopic pregnancy is silent, fast, deadly, but also preventable, if and only if it's detected early enough. This is not just a story, it is a warning, it is a lesson, and it might just save your life. If you found this story educative, share it with someone, it could save a life. Subscribe for more real-life medical stories explained simply and powerfully. Because sometimes, awareness is the difference between life and death. I will see you in the next video. Cheers.